When I first became involved with Children's Wish Foundation about 5 years ago, I remember having a few first impressions. My initial impression was what an unbelievably phenomenal organization, and what a sort of magical thing to be able to give the gift of a wish to children and families going through a severe, serious, life-threatening illness. After that, I actually thought a little bit about my own practice at a children's hospital, and thought it's interesting that some of the patients that I perceived as being the sickest of the sick and the most complicated patients were not actually eligible for a wish. They didn't actually meet the criteria at Children's Wish Foundation, or any wish granting agency for that matter.
We work with children with medical complexity, and for the children and families that we work with, the Children's Wish is really an exceptional opportunity to have a normative family experience.
These children suffer from significant difficulty with everyday life. They have care needs that are significant for the entire family. They are often fed through G-tubes, they have chronic life-limiting conditions, and are as sick as any child with a leukemia, cancer, or significant other medical conditions.
And the unifying factor for all of these children is that for their whole lifespan, they will be dependent on their parents, on their siblings, on their caregivers, for all of their activities of daily living.
And I think because they spend so much of their time focused around the care of the child, the medical needs of the child, it's an opportunity for them to escape that, think about how they can create those memories, that quality of life that sometimes gets forgotten.
What has really happened is that if you think back 20 or 30 years ago to when the original criteria were being thought out, these children were probably not surviving out of infancy, or perhaps certainly not out of preschool years. What's happened in the last 20, 30 years is there have been major improvements in neonatal and intensive care, major changes in medical therapies that have allowed this group of children to actually survive into adolescence, and actually in many cases now even into young adulthood. So I think this group probably didn't really exist 20 or 30 years ago.
I think it's an opportunity for the entire family to be together, for the entire family to spend a day where the focus is just on their enjoyment, on making memories and doing things that are really exciting and wonderful without having the focus be on the child with the medical complexity.
And if you think about the impact of that on a child and on the family, I think you have to come away with that thinking that who could possibly be more deserving of a wish and an opportunity to create something positive, some hope, some positive memories and legacy than this particular group of children.